I'm Mia. I'm going to be your student nurse today. I'm just going to start by getting your name and date of birth. And do you have any allergies? Perfect. Okay, so I am going to be administering fentanyl citrate today. It is an opioid agonist, so essentially it binds to those opioid receptors and it enhances that pain blocking response. And so you will have that pain transmission blocked. How much we'll see, and we'll obviously adjust your dosage based upon your responsiveness to the medication, but we just want to start low and slow. We're going to start at 12 micrograms in a little patch. It's going to be on your arm, and it's very strong. It's a very strong medication. It's 100 times stronger than morphine, and obviously we will administer a much lower dosage of this medication based off of that, but it will normally fentanyl is fast release, and so since we are going to be administering this through the patch, it will be really great for your chronic pain, especially since you have been receiving cancer treatments, you've been having a lot of pain related to your cancer, and you have also been on opioids for a longer period of time, and so you are opioid tolerant, which makes you a great candidate for this patch. It'll help with that chronic pain, and you qualify since you're opioid tolerant. The patch needs to be changed every 72 hours, and we're going to make sure it's placed in a good spot for you. But we want to make sure that we're not putting it in a warm area, especially you should not have any of those hot packs or heating pads on it with any opioids, but in the case of fentanyl citrate, there are some adverse effects that we are worried about that might be worsened by things such as having a hot pack that speeds up that administration of the medication to your tissues. And one of those is an anaphylactic reaction, some kind of hypersensitivity reaction. You might have itchiness, you might have difficulty breathing, you might have facial swelling. These are just adverse effects of the medication. That's not to say that they will happen, but you need to press your call light if you are noticing any of these symptoms, any sort of like itching or hives or anything like that, as well as opioids can slow things down a lot. And so you might have respiratory depression, you might have a lowered heart rate, you might have a lowered blood pressure, and so we'll be monitoring that, but you also need to make sure that you're watching out for that. You also need to be very careful when you're getting up and walking around. Make sure you're pushing your call light if you notice any of the symptoms, but also push your call light if you need to go to the bathroom or if you need to walk around. I know that you know how to walk. However, when you are on opioids, there's what's called central nervous system depression, and it kind of makes you get drowsy and you get confused sometimes, depending on your response to this opioid. And we want to make sure that we are getting you up safely and making sure somebody's with you to prevent you from falling, because we do not want that to happen. And just make sure that you're wearing your socks, your yellow socks, the treads on them, to make sure you're not slipping. And just be careful standing up and make sure that you're not trying to do anything too crazy. This medication will help with that high pain level that you've been having and that chronic pain that you've been having. It is a great medication, but we just want to make sure you're as safe as possible while you are on it. And